Hello everyone, my name is Dr. Tayfun. I'm going to present you a rare case, anterior approach to adolescent isolated humerus trochlear shearing fracture and literature review. First described by Logia in 1853, an isolated fracture of the humerus trochlear rarely occurs because it has no muscular and or ligamentous attachments and because of its location within the olecranon fossa, which makes it inaccessible to direct trauma. Due to the lack of information and the lack of high-level studies on this injury, a standard treatment protocol hasn't been established. In this report, surgery with an anterior approach with Herbert's screws for isolated humerus trochlear shear fracture in a slightly immature adolescent patient is described. In our review of the literature, we didn't encounter a case who underwent surgery with an anterior approach to isolated trochlear fracture in the adolescent patient group, and we think that we will contribute to the literature for this rare case. In the literature review, 20 reports of isolated fracture of the humeral trochlea were identified in the PubMed database. These included 27 adult cases. In pediatric cases, 4 reports of trochlear fracture were detected. In our study, a 13-year-old male adolescent patient underwent surgery for isolated humeral trochlea fracture. In faults in which the elbow is in an extended position, the radial head and coronate impact the distal article surface and may shear off variable osteochondral fragments. Our patient presented to the emergency department with complaints of pain and loss of movement in his left arm after falling out of bed, and clinical examination revealed swelling and tenderness on the anteromedial side of the left elbow without neurovascular deficit. The radiological examination revealed a crescent-shaped displaced bone fragment in the front of the elbow joint, as you can see in Figure 1. Isolated trochlear shear fracture was confirmed by computed tomography imaging, as you can see in Figure 2. Open reduction and internal fixation is the most commonly used surgical treatment for displaced trochlear fractures. The surgical method was planned according to the configuration of the fracture. An anterior approach was used because of the location and configuration of the fracture line. After the joint capsule was passed, the fracture line was reached, and after the fracture line was openly reduced, 2 headless Herbert screws were placed just below the articular surface, as you can see in Figure 3. Additional images were taken in lateral and anterior posterior views to confirm that the screws didn't cross the posterior cortex. You can see in Figure 4 and Figure 5. The motion of the elbow was evaluated during the operation. A long arm splint was applied to the patient to protect the surgical wound until a 1-week follow-up. Postoperative evaluation was made with a physical examination and the graphics of the patient. There was no change in the fracture line and screw configuration in the radiographs taken 1 week after the surgery. You can see in Figure 6, Figure 7. The range of motion measured for the right and left elbows at the 3-month post-surgery control were as follows. Elbow flexation was 135 and 130 degrees at the right and left elbows. Extension was 10 and 0 degrees. Forearm supination 19 and 90 degrees, and pronation was 19 and 90 degrees. Radiographs showed the presence of onion and the fracture line. Isolated fractures of the trochlea in the coronary plane are very rare. Most of the patients reported in the literature involving isolated humeral trochlea fractures are adults. Most authors use the medial approach for treatment, and there are no adolescent patients in the literature who use the anterior approach. Our patient, on the other hand, regained full range of motion after humeral trochlea fracture and treatment with the anterior approach, and we didn't encounter any findings indicating the presence of avascular necrosis or degenerative changes. We recommend the anterior approach to ensure anatomical reduction and proper fixation in this type of fracture. However, additional studies with longer follow-up periods and cadaveric studies are necessary before a consensus is reached with regard to the mechanism of fracture and the most appropriate treatment. Thank you for listening.